Right, and here's our agenda for today. So first, we're going to hear from Dr. Robert Jacobson on preparing for flu in the time of COVID-19. And then we will hear from Lieutenant John Naegeli on a flu clinic shots during the COVID-19 pandemic. Then we will get to hear from Christie Larmie on the safe delivery of vaccination services during a pandemic. So once again, we'll save all of our questions till the end when we have our question and answer session. Oh, sorry about that. Okay, so first up we have Dr. Jacobson. And let me just stop sharing my screen, Dr. Jacobson, so that you can share your screen. So Robert Jacobson is a primary care pediatrician at Mayo Clinic in Rochester, Minnesota. He is the medical director of the immunization programs for both adults and children for the primary care practices in Rochester, as well as South Minnesota Mayo Clinic Health System. He is also the medical director for the Population Health Sciences program at Mayo Clinic and conducts research investigating how to improve vaccine coverage. He teaches the principles and practices of pediatric research, as well as evidence-based medicine to pediatricians in training. He lectures widely on topics concerning vaccines. And today we get to hear from him on preparing for flu in the time of COVID. So I will hand it over to you, Dr. Jacobson.
Thank you very much, Valerie. I appreciate the opportunity to speak to you on this topic. I have a number of objectives for us today. By the end of this activity, you'd be able to identify the similarities with influenza and COVID-19, recognize the differences between influenza and COVID-19, and relate why we need to prevent every single case of flu this season, do whatever we can in our power to control the flu. COVID-19 and influenza actually share many symptoms and signs. They can both present with fever, cough, shortness of breath or difficulty breathing, tiredness or malaise, sore throat, a runny or stuffy nose, nasal congestion, and muscle aches or myalgias, as well as headache, nausea or vomiting, which is more common in children than in adults, and putting these all together, you think, well, they look very similar. Both range widely in severity and symptoms from none to severe. You can have COVID-19 and have no symptoms and spread it to others. You can do the same with flu. There's more commonalities. Both are spread by respiratory droplets and aerosols. Both suffer from the fact that close contact facilitates spread. And both may be mild enough to be treated at home with symptom relief, hydration, and bed rest. And yet both can have serious life-threatening complications: pneumonia, acute respiratory distress syndrome, acute organ failure, heart attacks, heart and brain inflammation, and stroke, and even cause death. And both COVID-19 and influenza are severe enough to require care in a hospital setting. But COVID-19 and influenza do differ. They're different viruses. COVID-19 is a new RNA virus from the coronavirus family. Influenza are viruses that are evolving RNA viruses from the orthomyxovirus family, so a different family of viruses. They have different levels of contagiousness. COVID-19 symptoms emerge 2 to 14 days after exposure, whereas influenza is more like 1 to 4 days after exposure. And there's different symptoms with COVID-19. The loss of sense of taste or smell are peculiar to COVID-19. We don't see that with influenza. There's more differences. COVID-19 not only has a different time span as when the symptoms show up from exposure or when the infection occurs after exposure, but COVID-19 is more contagious. It spreads more quickly and more often causes severe illness requiring hospitalization. Severe illness is far more common with adults with COVID-19, and with children and adolescents, actually severe illness is more common with influenza. The mortality rate is higher with COVID-19 and appears to be about 3 to 4% of cases as compared to less than 0.1% with influenza. And there's different complications with COVID-19, including blood clots and multi-system inflammatory syndrome in children, or MIS-C. And there's more differences. Flu is seasonal with outbreaks from December through May. COVID-19 does not appear to be seasonal. Flu can be treated with antivirals such as Tamiflu in the outpatient setting. And yet specific treatments for COVID-19 are not yet recognized, and work with antivirals in hospitalized patients are still under study. Flu and its complications can be prevented with vaccination. Flu vaccination, however, doesn't prevent COVID-19. It also has been shown not to increase the risk of COVID-19. And we need to recognize circulating flu is going to pose real difficulties for us as healthcare moving forward in caring for our patients. Having a case of the flu may result in the need for testing both for COVID-19 and influenza. And it's possible to be infected with both. Cases of flu, thus, will often end up requiring testing for COVID-19 and require care from healthcare providers already taxed with COVID-19 care. We're going to need resources from the healthcare systems that care for patients with flu. Again, these systems already taxed with the care for COVID-19 patients. Simultaneous infection with both COVID-19 and influenza may cause more severe disease. And given the impact on the household, the community, and healthcare of influenza on top of COVID-19 as a pandemic, you see, we need to prevent every possible case of flu this coming year to eliminate need for unnecessary testing, to the use of resources and healthcare workers in the care of flu. Now, flu seasons are unpredictable. Masking, social distancing, and hand washing, all now increased for COVID-19, may prevent the flu. The Southern Hemisphere's experience so far this summer has shown reduced reports of flu outbreaks being limited, few cases occurring. Now, the problem is, these are few cases occurring in terms of being reported. The other possibility, the likelihood, is in fact across the Southern Hemisphere, the healthcare systems are overwhelmed with COVID-19 case management, and in fact aren't able to detect or report flu cases occurring. We don't know the difference between the two. And given that flu seasons tend to be unpredictable, experts here say that we still have to focus on preventing the flu this fall, rather than wishful thinking that maybe it won't come around or it'll be blocked by what we're doing to prevent COVID-19. Now, prevention of the flu basically means we need to give all of our patients the flu vaccine this year, ideally by December in the Great Lakes region. We need to keep vaccinating while the flu outbreaks continue. And again, in the Great Lakes region, typically we have outbreaks through April and May. We need to continue COVID-19 prevention, as these appear to prevent flu too. We still need to avoid large crowds and mass gatherings, avoid close contact within 6 feet of those outside of the household, washing our hands with soap and water 20 seconds, and if soap and water are not available, hand sanitizer with 60% alcohol or more. Wearing a cloth mask when in public where close contact may occur, and avoiding touching your eyes, nose, or mouth. Cleaning and disinfecting high-touch areas often. Now, vaccinating persons with COVID-19 is a specific issue that has been addressed by experts, including those at the Advisory Committee on Immunization Practices. If we have a patient who is acutely ill and COVID-19 is suspected or confirmed, we should delay the flu vaccine until that patient is no longer acutely ill, and take care to make sure that patient does return for flu vaccination. Our following presenters this hour will discuss managing flu shot clinics during the COVID-19 pandemic, and the safe delivery of vaccination services, including the flu vaccine during a pandemic. So in summary, we need to be able to identify the similarities with influenza and COVID-19, as well as recognize the differences between influenza and COVID-19, and understand why we will need to prevent every single case of flu this season. Thank you very much for your kind attention. I look forward to hearing the next two speakers.
Awesome. Thank you, Dr. Jacobson. That was great. So now we are going to hear from Lieutenant John Naegeli, who is a pharmacist at the United States Public Health Service. He is currently stationed at the Cass Lake Indian Health Service in northern Minnesota. Since starting at Cass Lake IHS, he has been striving to increase access to vaccinations at the pharmacy. He enjoys spending time in the outdoors with his wife and two sons. All right, so I will hand it over to you. And let me just share my screen with your presentation. Just give me a second to get that up.
Good morning, and thanks for having me. Like Valerie said, I am a pharmacist here at the Cass Lake Indian Health Service Hospital. Next slide. Valerie went all over my information already, but here is my family and myself. We had a wonderful trip this summer to the Black Hills. If anyone's looking for a great vacation next summer, I would recommend the Black Hills. Next slide. Cass Lake is located in northern Minnesota. Our hospital is a federal facility, and we serve approximately 12,000 patients. Fortunately, we've been very lucky when it comes to the COVID. We've only had roughly 60 positive cases throughout our reservation and 0 deaths so far. Next slide. Planning in 2020 is not easy. I'd like to go over a story. On a recent elk hunting trip that I went on, it was more like elk hiking. There was no animals hurt in this hunting trip, but we had been planning this trip for 6 months, and approximately 2 weeks out, a large fire started within 20 miles of our location. We decided to go through with the trip because we were told it would be safe. This first picture is from Saturday. As you can see, it was beautiful, no smoke. Next picture is from Sunday. You can see that the smoke is growing. The heat, it was hot and windy that day. And by Monday, the fire had actually quadrupled in size. And unfortunately, a lot of primary residences were burned. And by Tuesday, that same area got 2 feet of snow, and it was a high of 30 degrees. So that is planning in 2020. Next slide. When it comes to flu shot planning, there's a lot of extra factors that we need to plan for in 2020. We have to plan for the safety of our patients and our staff. Do we have the proper PPE? Is our patients wearing a mask? Where should we have that clinic? Should we have it at schools? Are our schools open? Are they in hybrid mode? Are they on online mode? We had planned on a mass school vaccination program. However, right now our school is in online mode, so we can't do that. Are we going to meet at our senior centers like we normally do? That's not very likely. Normally we meet at places where people congregate so we can get a lot of people in a short period of time. That's not going to be an option this year either. And another option would be a drive-through. Can you handle a drive-through? Do you have the staff? And do you have the time to plan for the logistics for a drive-through? And then when it comes down to your clinic or your hospital, do you have enough staff to give the flu shot? Currently, we have a lot of staff on safety leave, so we're short on staff with nursing and administration. Is your pharmacy open? Currently, our pharmacy is delivering all the meds to curbside, so we don't have patients coming into the facility. So right now, our facility is only allowing ER care and same-day clinics and very limited chronic medication management. Next slide. Going back to pre-COVID, in March, I went to a training, emergency management training, and this training was on points of dispensing. Prior to that, I had no idea what point of dispensing was. Next slide. Point of dispensing is a community location that we can dispense mass amounts of medical countermeasures such as antivirals, antibiotics, antitoxins, and chemical antidotes. Some examples would be a terrorist attack. If anthrax was distributed throughout the air systems or in our communities, we'd have to get antibiotics within 48 hours. And this training is set up to plan for something like that. It can be used by tribal communities, community governments, county governments. There are closed PODs, which would be possibly like your hospital system might have a closed POD and could have a plan in place to distribute medications, or it could be open POD where it's open to anyone in the community. Next slide. So as we were planning for the 2020 flu shot campaign, the light switched on here, and the POD training is going to come in handy. Next slide. So our plan at Cass Lake is to do a large drive-through clinic in a couple weeks here. We are partnering with the Leech Lake Band Health Division, the County Division, and with the local casino. We're going to make this event available for all patients, not just IHS eligible patients. The Cass County will be able to vaccinate those that are not eligible at IHS. We're going to provide prizes and incentives for our patients. We have a big goal to vaccinate over 500 patients in that 8 hours. And this is going to be a big test to see and test our capabilities on the COVID-19 vaccine that might be available in the near future. Next slide. The POD and drive-through planning, we structured it similar to incident command system. We went through the throughput and we studied on how many patients we're going to see and how many staff members we're going to need. So our plan is to provide 3 vaccine lanes with 3 vaccinators per lane. We're going to need 6 people for information, handing out paperwork, and directing them to the proper lines. We're going to partner with the Leech Lake Police Department for security. We're going to have an additional 3 people to run errands and run back to the hospital if needed. And then we're going to have our site coordinator that's going to be responsible for the command and operation of that flu shot clinic. So roughly we're planning on 20 people, and we're hoping for an equal amount of county, tribal, and IHS staff members. And we also have plans for weather and possibly if a fire or a vehicle stalls, we do have plans for that. And it is 2020, so we do expect snow, rain, or wind, or a combination on October the 3rd. Next slide. We will have, planning for this, we will have a walkthrough tomorrow with everyone that's involved at the site. We're going to create job action sheets, identify bottlenecks, and provide possible solutions. We're going to identify leads for each position. And then next week, we're going to do a test run for our employee vaccination program. We're going to have our dental department drive over to the casino parking lot, and we're going to do a dry run. To try to get as many patients as possible, Leech Lake is going to take the lead on marketing, so we're going to try to market using the radio, newspaper, Facebook. We're going to try this is new, but Leech Lake can send out information with their payroll weekly and bi-weekly, so we're going to send out flyers with pay stubs. The pharmacy is going to send out bag notes, and we're also going to put flyers up at the local grocery stores. And our local school does a Tuesday packet, so they send out information to the parents and students on Tuesdays. So we're going to get our information to the schools and have them distribute the flyers and screening forms to those students. Next slide. This was a head of household dispensing form that was in the point of dispensing training book. As you can see, or as you know, for a family member or a parent, it's very time consuming when you have to fill out a form for each member of your family. You commonly have to write your address 4 or 5 times, write your phone number down several times, and it just is cumbersome. So we stole this idea from this training book, and if you can go to the next slide, we're going to try this out for our flu shot drive-through. So we're going to have the head of household fill out this form with all the information. We're going to do a screening for everybody here and document the vaccine. This is a trial run. I'm hoping that it's going to go smoothly, and we'll be able to make improvements on this form after we're done. And another important thing I didn't add to the slide is that we are going to make sure that we do a hot wash after our drive-through. We're going to make sure on Monday we're going to get together and make sure we go over the things that went well and the things that did not go well. Next slide. Following our drive-through, nursing is going to start offering flu shots at all walk-in and clinic visits. Plans are in place to open our pharmacy window on October 5th. So pharmacy will start giving flu shots then to all walk-in patients. And then our Leech Lake band of Ojibwe nursing staff will provide those listed flu shot clinics in our rural areas. Next slide. And that's all I have for you, so I'll take questions at the end of this next presentation. Thank you.
Great, thank you so much. That was fantastic. All right, so next we will hear from Christie Larmie. So Christie Larmie is a public health educator for the Wisconsin Immunization Program. In this role, she serves as a regional advisor for the northern part of the state, providing technical assistance and education as it pertains to immunizations and vaccine-preventable diseases. Christie has a master's degree in public health, and today we have the pleasure of hearing from Christie on the safe delivery of vaccination services during a pandemic. So again, please just give me a second to share my screen so I can get your slides up there, Christie.
Okay, thank you, Val. Oh, yep. Thank you, Valerie. I appreciate the introduction. So today I will talk about the safe delivery of vaccinations, really focusing on the influenza vaccine. So next slide, please. A couple of the objectives is first, I'll just kind of talk about some general considerations for this year's flu season, and then we'll kind of move into some safety considerations if you're giving influenza shots in the provider's office, and then finally some safety considerations if you're holding an influenza clinic like the last presenter just talked about for a drive-through. Next slide, please. So first we'll talk about some general principles. Next slide. So like our first presenter said, the flu shot is going to be really important this year to get out to as many people as possible to really reduce the burden on our community resources and our healthcare system. And then that's going to be really important to communicate that to the general public, but it's also going to be important to communicate to the general public that it's safe to come into the clinic, or it's safe to come to these mass clinic type settings, and these are what we've put in place to make them safe. And then finally, we really want to look at providing protection as soon as possible and minimizing healthcare visits. So when we're talking about this with influenza, we know our kiddos are 6 months through 8 years. If they previously haven't received 2 influenza shots, will need 2 influenza shots this year to be fully covered. So just thinking about that and how are you going to get those kiddos in to get that full protection. Next slide, please. So like I said, it's going to be really important that we get everyone vaccinated. However, there still are some groups we want to focus on, and those are going to be our essential workers like yourself. We're also going to want to look at giving the flu shot to people who are at increased risk for severe illness from COVID-19. So we know those folks over 65, and then also there are some minority and community members that have been adversely affected. We're also going to want to look at people who are at increased risk for severe illness for influenza. So, you know, our infants, our pregnant women, and our individuals over 65. Next slide, please. So now I will kind of talk about some safety recommendations you can implement in the provider's office. So I'll just briefly go over this since some of you have probably been implementing a lot of these already. However, if something that you haven't heard about or would like more information, I've included a link to the resource that the CDC has provided and where these recommendations come from. Next slide, please. So the first consideration is we really want to minimize your exposure to COVID-19. So this includes screening maybe before the patients come in. So if you call them for a reminder appointment, you could screen them for symptoms and exposure, you know, or do it at the front desk. And then also to minimizing the points of entry into a clinic, and then also requiring a mask. Also too, you want to make sure that you're using the proper PPE when you're seeing these clinics, no matter the setting. And when we talk about PPE recommendations during vaccine administration, when we're looking at giving an intranasal vaccine, such as flu mist, there is an increased chance that we will come in contact with our patient's mucous membranes or bodily fluids. So we want to make sure that we're gloving and that we're switching those gloves between patients and following proper hand hygiene. The CDC has determined that this is not an aerosol generating procedure, so the use of an N95 or higher is not recommended. And then if we're giving injections, if we do use gloves, to make sure that we're changing those in between patients and then following proper hand hygiene. Next slide, please. So really now let's kind of talk about some social distancing measures we can do in a clinic. So this might be your typical clinic setting, but what's some things that we can do to really promote social distancing? Next slide, please. So our best strategy is going to be trying to separate the sick from the well. So we can do this by scheduling practices. So some examples could be trying to get well patients in the AM, you know, people who are coming in for flu shots or other preventative services, and then maybe sick in the afternoon. Or you could do it by days. Maybe Tuesday, Thursday, you try to dedicate to well, and then Monday, Wednesday, Friday for sick. That's not always practical or possible, so you could try to do some separating in the clinic. So this could be using different waiting rooms or trying to separate the waiting rooms, one side for sick patients, one side for well patients. You could look at using different entrances and different reception desks. Some other strategies that have been implemented is having people waiting in cars or other marked areas. One thing about the cars I do want to mention is we have to remember our community members that have to use public transportation or maybe don't have access to a car to wait in if their family member or friend was giving them a ride to their appointment. So really having a backup plan for that as well. Then using physical barriers and markers, so those, if people have to wait in line anywhere, keeping those markers for 6 feet, and then physical barriers. So, at the reception desk, you could put up some plexiglass or, in the waiting room, sick from well, a partition. And then lastly, be thinking about this at all aspects of the visit. So we talk a lot about reception in the waiting room, but keep in mind once someone goes back to the patient room, they may have to move around for imaging or lab. So how are we thinking about keeping that social distancing at other parts of the visit? Next slide, please. So now I'll kind of talk about some safety considerations at influenza type clinics. So this year, given that we'll have 2 circulating respiratory diseases, we may have to deliver the flu shot differently this year. So I will talk a little bit about what those methods might be, and then some safety precautions we can put into place. I'll also mention, and at the end, I've included the link to the resource because there's a lot of information in regards to this, but I'll just really try to hit on the considerations given that we're in the midst of COVID-19. Next slide, please. So when I'm talking about immunization clinics or influenza clinics, what we could be talking about is, a satellite, an offsite, or a temporary location. So, if you have a community room somewhere in another building, or let's say you have another clinic, so one of your sites might be for sick patients, another one might be for well. So mass clinics, so maybe at the end of a Wednesday from 6 to 4, you allow everyone to come in and all they get is the influenza vaccine. So a lot of people in a short amount of time. Drive-through clinics, curbside services, home visits, or maybe mobile outreach units if that's possible. Next slide, please. So just some general considerations, no matter what type of influenza clinic you're looking at, is we always want to remember storage and handling of the vaccine and making sure that you have the proper resources to take that vaccine to a location other than, your designated unit. So, we don't want to have temperature excursions and then make the vaccine not viable. Another thing to consider is vaccine administration general guidelines. So giving an immunization through a car window could be a lot different than being in the, the comforts of the patient's office. So making sure you're comfortable doing that, and then also to comfortable following those general guidelines, needle size, etc. And then finally, having a plan for documentation. So when you're seeing a lot of patients in a short period of time, sometimes documentation can become a real burden, but we really want to make sure that that is complete and accurate for our records, as well as, the patient having documentation that they've received an influenza shot. Next slide, please. So now we'll kind of talk about kind of those social distancing and safety measures. So we're going to follow a lot of what I mentioned in the clinic setting. However, it might just look a little different depending on what setting we have one of these influenza clinics. Next slide, please. So really, we want to prevent this. So if anyone has ever been to a mass clinic, it's usually a lot of people lined up and waiting for their turn. So let's kind of discuss some ways that we can prevent that. Next slide, please. Before I get into that, I just included this. This is something that came from the CDC resource, and it kind of shows the planning documents they have. So this is just an example of what they have available for a drive-through clinic or a walkthrough clinic. And what it does for each of these steps, it talks about safety considerations, resource considerations that you should try to implement to make sure that people can come to these clinics and be safe and not, exposed. Next slide, please. So what are some considerations that we can think of? So the first one is location size and consideration. So if you've held these clinics before, where you held it might not be ideal anymore. So let's say you had them in a conference room. There really might not be a way to maintain 6 feet in a conference room. So maybe you need to move to a gymnasium or have people come at different times. So really trying to, how many people are you going to see, and then does your location allow for that? Next is strategies to manage patient flow. So like our last presenter said, with the paperwork and stuff, that can really bottleneck people in the beginning for registration. So thinking of creative ways, and do we have the space that every step that someone is at one of these clinics, they're able to maintain that 6 feet. So some of those might be, can we do early registration at all? Can we do online registration? Can people fill out their paperwork in their car and then, go to the nurse or who's going to be giving the immunization? So different ways where we typically see people kind of get together during a mass clinic. How can we disperse that a little bit? Also to staffing and resources. So because we are going to have to be thinking about not having people bottle up in some place at our clinics, we really are going to probably need more staffing and more resources. So really thinking about how much staffing is needed. Do we need people to kind of manage patient flow, get people through, and what kind of resources is that going to take? And then finally, we really want to look at strategies to protect the most vulnerable population. So, our pregnant women, our community members over 65, if they're coming to one of these clinics, how do we make it safe for them? Maybe we allow the first hour of one of these clinics is kind of more for them, or maybe if we have a small space off to the side, that's where our, maybe pregnant women are seen. So really keeping in mind that there are some more vulnerable populations, and we really need to think about safety measures for them coming to one of these clinics. Next slide, please. So I know these slides will be shared with you. So here are the resources that link to the CDC with all of the recommendations I went over, and then in a little bit more detail. So if you see something you have questions about, you can always look to one of these resources to get a little bit more information. And then next slide. And then just any questions. So I think we're going to kind of do that at the end. So thank you. I appreciate you allowing me to talk on the webinar.
Great. Thank you so much, Christie. Yes, so we will go into a question and answer session now. And give me just a quick second again to get that up with the instructions on how to unmute yourself. I think what we will do is if you can raise your hand, if you have a question and you're on the computer, you can raise your hand, and then we will call on you, and then you can unmute yourself and ask your question. Otherwise, you can ask your question in the chat box, and we can read it out to the presenters. And if you are on the phone, one way to unmute yourself, or to raise your hand, sorry, is to press *9. All right, so I will start us out. I think we have some questions in the Q&A. So we had one question that was during Christie's presentation. Is the drive-through clinic free?
I apologize. Could they provide more context to that? Do you just mean does offering one free, or what do they mean with that question exactly?
I'll give her a second to type in. Oh, I'm sorry. That was actually for the second presentation. Is the drive-through clinic free?
Yeah, I can chime in there. So for all IHS eligible patients, it'll be free. And then for the non-IHS eligible patients, the county will be vaccinating them. And if those patients are insured, they're required to bring their health insurance cards in. So the county will take care of that. And then if they are not insured, they will use their uninsured adult vaccine program, and that's how they'll be vaccinated.
Great, thank you. All right, we have another question in the chat box. What is the best way to vaccinate patients who don't have transportation to influenza clinics? And I'll open that to anyone who wants to answer.
This is Christie Larmie. I can kind of take a stab at that question. So, I would have to say the best way to really get to those people is through home visits. However, that is very labor intensive and, given all the resources we have with COVID, it might not be feasible. So, you could try to look to hold clinics more in the community. So maybe they don't have transportation to the clinic, but maybe they have transportation to, a neighborhood community room or something like that. So really trying to get in the community and getting closer to the people, if that's possible.
I would just like to add that another approach that I think we need to keep in mind is to continue with patients that must be seen in person for other conditions, to vaccinate them at that visit, and have a basis, what we call cocoon visits, to go ahead and vaccinate those who are attending that visit with them. While during this pandemic, we restrict the number who can accompany a patient to the office if they need the flu vaccine, we aren't going to make them wait. We will give it in the office when we give the patient the vaccine.
Great, thank you both. All right, we have another question in the chat. Do you foresee misinformation surrounding vaccines being a barrier to vaccination rates this flu season? And then a second part, how do you recommend addressing misinformation? And again, I'll open that to any of our presenters.
I'll start. I think this is going to be a real problem. We are already seeing in the communities resistance towards a COVID-19 vaccine, fears of it being rushed, fears of it not being safe. In some way that spills over and touches other vaccines. We've always had long-standing distrust of the flu vaccine. And I recommend that you use your position as a healthcare worker to address those each and every time they're brought up. When a patient says, I won't be getting the flu vaccine, you should pause and say, I'd like to hear more. I'd like to learn why exactly you don't want to get the flu vaccine. I encourage you to have that conversation to get specific, to understand why their hesitation, and then to address it then and there in terms of your strong recommendation that your patients get the flu vaccine, rather than leaving it unaddressed. If we feel strongly about the medical care that we're providing, about the preventive services our patients need, we can't leave these suspicions and hesitations unaddressed. We have to make sure our patients know what we want them to do and where we're coming from, and we have to address their concerns. They're real and they will be a problem for us.
Great, thank you so much, Dr. Jacobson. All right, we have another question in our chat box. with a goal of vaccinating 500 people in one day, what goals do you have for completing EHR and IIS documentation?
That's a great question. I think that task is going to fall on a few individuals that are going to have to work a lot of extra overtime on Saturday evening and Sunday to enter those. I don't think it's totally been addressed in the planning, but our goal is to have all those visits and vaccines entered by the end of the business day on the following Tuesday. So I'm going to use pharmacy staff and nursing staff to assist, and hopefully we can make sure that all that documentation is done as quickly as possible. But it will be a big task. I don't think it's going to be done during on the vaccination date. I think it'll follow on Sunday, Monday, or Tuesday.
Great, thank you so much. All right, it doesn't look like we have any more questions in the chat box. I might give it a few seconds just to see if anything comes up. All right. All right, well, oh, sorry, we just had another question. All right. Where did the 500 patient goal number come from? I think that's for...
Sure.
Yeah.
Our goal is we'd like to do more than 500. However, we don't want to, we're planning for 1,000. Our goal is 500, and we just don't want to totally overshoot. Normally we do roughly 2,200 flu shots a year. That's throughout our whole EHR system. That includes our tribal nurses document in our system also, including the outside vaccines that we document. So I'm hoping that if we can do a quarter of our vaccinations in one day, I'm hoping that'll decrease the need for screenings for PPE, and that's the main goal, is to decrease the demand at the Cass Lake Clinic. So I'm hoping our workday is going to be a lot easier if we can get rid of or complete 500 vaccinations, or a quarter of our normal vaccinations. If we can do that in one day, I think that'll really help our workflow over the next 3 months. I hope that answers that question.
Awesome, thank you. All right, and we have another question. How do you recommend combating fears about receiving the COVID-19 vaccine when individuals feel like it has been expedited?
I think we as healthcare providers need to understand what aspects have been expedited and what aspects actually are completed successfully. We need the phase 3 studies that show that the vaccine is safe and effective, not just that makes antibodies. We need it tested in tens of thousands of patients. The FDA has set a requirement that it prevents at least 50% of cases, not just that it makes antibodies. I think we have to hold our federal leaders to that commitment to complete those studies. There are other parts of expediting that the federal government has put in place that are good and safe. The federal government has helped fund the studies that are normally just funded by the vaccine companies. In fact, the US government is funding 3 of those studies. The FDA, at least with one of the companies, is meeting weekly with the manufacturer as they conduct their phase 3 studies rather than less frequently. Those kind of expedited efforts are safe and noble and good. But we cannot let our federal government avoid the commitment to conduct the safety and efficacy study. I'm only going to be recommending studies, vaccines for my patients that are proven to be effective and safe. Once the studies are there and we have that vaccine, then I can make that strong recommendation and address my patients' concerns. I think we're in a peculiar situation. We want a COVID-19 vaccine. We want it as soon as possible, but we don't want it any sooner.
Great, thank you so much for that. All right, it looks like we don't have any more questions, and since we are getting close to the end of the hour, we will go ahead and move on. So I just want to thank you so much to our presenters. Thank you for sharing all of your knowledge and insight with us. We really appreciate it. To all of our attendees, we will be sending out the slides as well as those links, I think that Christie shared. Those will be in the slides. So I just have one quick thing. We just wanted to put out a quick announcement that Great Lakes Intertribal Epidemiology Center is releasing some flyers and posters for the flu season. So ITUs in the Bemidji area are able to order these materials from GLITTech at no cost. If you are out of the Bemidji area, so out of Michigan, Minnesota, Wisconsin, or Chicago, then we will be putting these materials up on our website, and you can download them and print them out for free as well. So I will also share that link with you in the follow-up email along with the slides. All right, and I just want to thank you again for joining us. If anybody has any questions, please feel free to contact myself, Valerie, or my colleague Megan Porter if you have any additional questions. And thank you so much, everybody, for joining us today. And again, thank you to our presenters. We appreciate your time. So everybody have a great day.
Thank you.
Thank you.